The Department of Anesthesiology at CHEO has a newly developed regional anesthesia program which offers innovative ways to treat children after surgery. By using techniques to temporarily block the pain signal at the nerves, they are able to decrease the sensation of pain. This program intends to improve pain control, allow for discharge home the same day, faster recovery and return of function, and lastly, improve overall care and satisfaction. Children who get regional anesthesia would use less oral pain medications, which are often associated with unpleasant side effects.
Every part of the body is supplied by a specific nerve. These nerves carry pain signals to the brain. We can target those nerves by using ultrasound technology and inject numbing medication around them. This is called regional anesthesia, or in other words, peripheral nerve block, because only the part of the body where you had surgery is being anesthetized. General anesthesia is when the whole body is anesthetized, whereas regional anesthesia only involves the affected limb. They can be performed individually or in combination. The single injection of numbing medication has limited duration of action. In order to make your nerve block last longer, your anesthesiologist will place a tiny tube called catheter around the nerve. The nerve catheter is then used to deliver medication continuously through a special infusion pump called ON-Q. Here's an example of femoral nerve block, the nerve that supplies the front of the knee. Most often at CHEO, nerve blocks are done asleep. After cleaning the area, we identify a femoral nerve with ultrasound and insert catheter adjacent to it. Then the catheter is taped to the groin and connected to ON-Q pump. You would be sent home with nerve block catheter and ON-Q pump.
ON-Q pump is a disposable balloon type pump filled with freezing medicine here at the CHEO Pharmacy. It has a clamp, filter, tubing, flow controller or restrictor, and a distal port, which would be connected to a nerve block catheter by your anesthesiologist. As ON-Q pump delivers your child medicine, the outside bag on the pump will begin to get looser and wrinkles will begin to form. Because the medicine is infusing very slowly, it may take longer than 24 hours after the procedure to notice that change. The pump will give your child medicine for 2 days. Once the pump is empty, the outside bag would be flat and a hard tube can be felt in the middle of the pump. The pump is portable. It may be clipped to your clothing or placed in a carrying case provided to you. The temperature will affect solution viscosity. Therefore, flow rate on the pump will increase with an increase in temperature and decrease with a lower temperature. In order to prevent variability in the infusion rate, please follow these rules. Make sure that the lower part of the pump tubing with flow controller is next to your skin. When your child or teen is sleeping, place the pump on a bedside table or on top of the bed covers. If you place the pump underneath the bed covers or a pillow, the pump may become too warm. Do not submerge the pump in water. If you want to take a shower, keep the pump, catheter site, and filter away from the water. Use a sponge bath. It's not unusual for your child or teen to notice the difference in 6 to 18 hours after the surgery. Pain medications such as Tylenol, Advil, or Celebrex, and morphine or hydromorphone as prescribed by your anesthesiologist if you haven't already done so. Ensure the numbing medication is infusing by looking at the clamp and making sure it is in an open position. Look at the tubing to make sure there is no kinking. Look at the connection site between the pump and the nerve catheter to make sure it is not disconnected. If the pump tubing accidentally becomes disconnected from your child's catheter, do not put it back in. Close the clamp on your pump tubing and call the phone number provided in the pamphlet or at the end of this video. If you see the leaking from the tubing or the pump tubing, please close the clamp and call us. If you observe excessive leaking from the catheter site and the tape is coming off, please reinforce it with a big Tegaderm that will be provided to you and call us. If your child or teen has ringing or buzzing in the ears, numbness and tingling around the mouth, a metallic taste in the mouth, lightheadedness or dizziness, blurred or double vision, nausea, vomiting, drowsiness, or increased anxiety, shortness of breath, shakes or tremors, it may be a sign of a serious medical condition. Immediately close the clamp on the pump tubing, call 911 or call us to prevent serious injury to your child or teen.
Hello, I'm Dr. Darlene Weeks, one of the anesthesiologists here at CHEO. I will be showing you how to remove the continuous nerve block catheter. When the pump empties and the infusion is finished, you will remove the dressing and catheter by yourself at home. First, start by washing your hands or using hand sanitizers to make sure they're clean. Next, gently lift and remove the dressing covering the catheter insertion site. Grasp the catheter as close as you can to where it enters the skin and gently pull it out. This should not cause any discomfort, and a small amount of blood or fluid drainage is normal. Once the catheter is removed, hold pressure over the site for 1 minute with sterile gauze. Then you can apply a Band-Aid. The Band-Aid can be removed once the area remains dry. Inspect the catheter. The tip of the catheter should have a black dot. This tells you that the entire catheter was removed successfully. If you don't see a black dot, please save the catheter and call us. Once you've successfully removed the catheter, dispose the pump and the catheter in the garbage. Please note, if the catheter is difficult to remove, causes pain, stretches as you pull, please do not remove the catheter. Excessive stretching may cause the catheter to break. Wait 30 minutes and try again. If the same problem occurs, cover the catheter with gauze and call us for further instructions. If you have any questions or concerns, please contact us. Remember, we're here to help.